A few weeks ago, I was on a call with a VP of HR at a major hospital system. At one point, she paused, sighed, and said, "We're paying nurses to leave." She wasn't exaggerating. $10,000 sign-on bonus to join her hospital. $15,000 sign-on bonus to switch to the hospital just down the road a few months later. Another $15,000 to jump ship yet again to a third hospital just 18 months after that. Then she said the quiet part out loud. We've built a system that rewards leaving more than staying, in the very moment where we need clinical talent more than ever. That sentence stuck with me. And then, the very same week, it followed me home. My husband, Matt, is a surgeon. One day that week, he said almost casually that his favorite OR nurse had just left. I asked, "How many times has that position turned over?" He didn't hesitate. 3 times that year alone. So let me ask you something. How many of you, just raise your hands, have ever had surgery or had a loved one have surgery? All right, I am seeing just about every hand in the air. Now, picture that moment right before anesthesia. You're lying on the table. You're vulnerable. You're handing over control. In that moment, you're not thinking about labor markets or workforce pipelines. You're thinking, am I safe? Do these people know each other? Can I trust this team? But here's what you don't see. You don't see whether this team has worked together for years or just days. You don't see whether the new nurse, let's call her Jennifer, has done this procedure with this surgeon 100 times, or whether today is one of Jennifer's first days on the job. In the very moment where trust matters most, the system is designed for turnover, not teamwork. And frankly, the system keeps making it harder, not easier, to enter and stay in healthcare. How so? 3 ways. First, training costs more and it takes longer. Healthcare loves degree inflation. Critical roles like nurse anesthesia and physical therapy used to require master's degrees. Now they're doctorate degrees, AKA code for more time in school and more student debt. Second, the career is front-loaded with financial risk. Recent federal changes have now capped student loans, leaving students scrambling to cover up to $100,000 in remaining costs. And third, the money only shows up after people are ready to leave. Hospitals spend billions of dollars on sign-on bonuses and contract labor, instead of proactively investing in full-time talent earlier. The system doesn't just strain talent, it blocks it. This all comes down to an incentive problem, and patients pay the price. Healthcare, like many industries, treats education, employment, and equity as separate worlds. Different budgets, different systems, different leaders. But for students, these systems form one continuous arc. Students take the leap of faith. They enroll in school, and they take on massive amounts of student debt just to get trained. Employers spend billions of dollars reacting later on sign-on bonuses and contract labor. And governments, they fund short-term relief when shortages turn into crises. But almost no one funds the bridge between education and employment at scale. Darby, a nurse anesthesia student I met while building CLASP, articulated this perfectly, saying starting her career without the right financial support would mean having to worry about how to manage her student debt instead of focusing on how to be the best provider for her patients. And you know, she's right to worry. Half of new nurses leave their first job within just 2 years. Now, this is the moment we'd usually blame the individuals. Oh, they're burned out, they're not loyal, they have a bad work ethic. But the reality is, they're leaving their teams for a higher paying hospital, not because they stopped caring, but because the math stopped working. But, and this is the interesting part, when hospitals do something different and invest in students while they're still in school, support them through training, and tie that support to multi-year employment with financial incentives, the results completely flip. I mean, students persist through graduation at higher rates. Candidate pools, they're larger, they're more diverse. By the way, that helps better reflect patient populations. And most employers are seeing applicants from 10 plus states. And lastly, clinicians really grow their roots with employers, which takes turnover and slashes it in half. So whenever I explain this idea to someone, inevitably they say, "That sounds nice, but has this actually ever worked before?" Yes. And I know because when I was 15, I accidentally discovered the blueprint. I signed up for what I thought was a typical high school leadership camp and showed up to the USS Lexington, a retired aircraft carrier in Texas in hot July. It turned out to be a military leadership camp. That summer, I listened to ROTC students talk about their futures, about how the military was investing in their education early, supporting them through training, and giving them a clear path after graduation with less financial stress. Nearly all of them are still serving today. So yes, this works. The military has been doing it for over a century through ROTC programs. Now, before you picture me trying to get nurses to do push-ups at 5 in the morning, hear me out. I am not talking about the uniform. I am talking about the financial plumbing and the incentive structure. It's stable, it's simple, and it's been fueling one of the world's largest workforces for generations. So, what if healthcare borrowed that blueprint? Here's what it would look like in practice. A hospital would identify promising second-year nursing students who have what it takes, but are quietly doing the math on whether they can afford to finish. The hospital reaches out with early offers. Now, here's the thing. Tuition doesn't get paid up front. There's no risky bet on unproven students. Instead, it's a commitment. If you graduate, pass your licensure exams, and join us, we will help repay your student debt on a monthly basis over your first few years of employment. This model applies to any clinical role, not just nurses, rad techs, respiratory therapists, nurse anesthetists, and more. It supports any type of student loan, federal or private, and it builds multi-year retention. The loan repayment would begin once the student is fully employed and is paid on a monthly basis over the first 2 to 4 years of service. Now, this isn't charity. It's a service commitment model for healthcare, a private market ROTC-like framework built to make a meaningful difference for the people who care for us. For example, Matthew, an optometry student we worked with, he grew up in poverty. For years, he delayed going back to school, not because he lacked ability, but because he couldn't afford to take on nearly $200,000 of debt. But when he heard about employers willing to give him earlier commitments to a job and help repay 2 years of his tuition over the first few years of employment, everything changed. He powered through school highly motivated. He started his career in private practice, a path he didn't even imagine possible before. And he grew his beautiful family with much less financial stress and much more peace of mind. That's what happens when the system stops betting against people and starts building with them. So, what if we stopped paying nurses to quit and started supporting them to stay? What if employers and educators and policymakers worked together to build one continuous path where students of every background could afford to not just survive, but to thrive? If we do this, we reimagine what it means to care, not just for patients, but for the people who care for them. A nurse's decision to stay shouldn't hinge on the next sign-on bonus. It should come from knowing that the system invested in them long before their first shift. Maybe then, that great nurse that my husband lost would still be there, not because she owed the system, but because she felt like they were building something together. Because when we fund commitment instead of churn, we don't just keep people longer. We build trust. And trust, more than anything, is the real infrastructure of healthcare. Thank you.